Hello, I'm Dr. Stephen Roman. One of the questions I'm most frequently asked is, what is regenerative medicine? Regenerative medicine is a broad term which describes many different technologies used to restore or replace diseased or damaged tissues to return the body to its healthy state. The term regenerative medicine was first used by Leland Kaiser in 1992 in a paper where he described technologies that would impact the future. The term reached widespread use after being mentioned at a conference in 1999 by William Hasseltine, when he described an emerging field blending the fields of tissue engineering, cell transplantation, stem cell biology, biomechanics, prosthetics, nanotechnology, and biochemistry. Regenerative medicine is used by oncologists in the treatment of cancer. It's even allowed for the growth of tissues and organs outside of the human body for transplantation. There are many studies which continue in the treatment of incurable diseases such as spinal cord injury, stroke, macular degeneration, and Parkinson's disease. Some of the most commonly used agents in the field of regenerative medicine are stem cells. Stem cells are cells that can replicate themselves as well as transform into other cell types. Embryonic stem cells are derived from human embryos and are very controversial. They are rarely used today, and we do not use these at our practice. The type of stem cell that you've probably heard of is the adult stem cell. These are also called mesenchymal stem cells. These can be found throughout the body. Regenerative medicine is one of the most promising new areas in the treatment of spinal and orthopedic disorders. In these areas, several regenerative therapies have been used, including the use of components of patients' own blood, which are then re-injected to create a regenerative response. Another commonly used regenerative therapy in spinal and orthopedic disorders is the use of stem cells. The most common source of stem cells are from patients' own bone marrow and fat. These therapies capitalize on the body's innate regenerative capacity. By delivering a regenerative agent to the site of pathology, we can stimulate the body's regenerative capabilities and accelerate healing. In the fields of spinal and orthopedic disorders, we're not yet able to grow back a patient's cartilage or return a spine to its youthful state, but these therapies, where we use a patient's own blood and cells, have been shown to be safe and in some cases effective in reducing symptoms. We are now only at the frontier of this new specialty, and I believe it is the future of medicine.